Right, hi everyone. Thanks for joining us on this slightly unseasonably warm August day. Thanks to everyone who submitted questions for today's Wesser Q&A session. As you well know, over the past 4 months, we've been creating and sharing a lot of knowledge and experience regarding the relaunch of face-to-face fundraising, predominantly door-to-door in the UK. This is taking into account things like changing government guidance and information from regulated bodies, but hopefully we can give a bit more information today about the things we haven't perhaps covered in collaboration events or the information we've published online. So if you're a follower of Wesser on LinkedIn or Facebook, you'll have likely seen our fundraising materials and our fundraising relaunch guidance already. If not, you can find it at the bottom of the homepage footer at wesser.co.uk. Plenty of information there, along with lots of hyperlinked information about the different policies and procedures that we've put in place to make sure that we can safely and carefully return to fundraising in the UK. So last week we published an item on LinkedIn asking for questions that you felt had not been answered, or you felt you needed a bit more information about with regards to the relaunch of face-to-face. It's stuff that we have covered in various collaboration events, but there are certain items that need fattening out a little bit and people wanted a little bit more clarity. So we had a whole host of questions come in. We've minimised that down to approximately 10 questions today, so hopefully we'll cover that off in the next sort of 10 minutes or so. And having relaunched on the 6th of July on behalf of St John Ambulance, we can hopefully give plenty of insight and help you get back into the field, or at least prepare your teams for getting back into the field over the next month or two. So I think we can all say it's been a challenging time for everyone. As always, we're always open to sharing as much information as we possibly can to make the sector more resilient and get the best out of our fundraising teams. So hopefully we can inspire you in some way today. So first of all, let's do a quick introduction. So I'm going to hand over briefly to, starting with James, actually, if you want to give us a quick introduction about your role at Wesser.
Hi, I'm James Dennis. I'm the National Campaign Manager here at Wesser, and I'm responsible for all of the face-to-face fundraising teams up and down the country.
Fantastic. And Matt?
Just have to remember to unmute myself there. Yeah, I'm Matt Bradley. I'm Recruitment Manager, and I also deal with a little bit of IT on the side as well.
Fantastic. The classic line there, "you're on mute," has been used pretty much up and down the country for the past 4 months. So on to Jade.
Hi, I'm Jade. I'm the HR and Administration Manager. So I am responsible for all things humans and also our administration departments.
Brilliant. And then Joey.
Hi, I'm the Operations Manager, responsible for training and compliance, support retention, and the telephone fundraising and supporter care teams.
Brilliant. And on to Martin.
Hello there, I'm Martin Wesser. I'm the owner of Wesser Limited in the UK and Wesser in Spain. At the same time, I do hold some participation in Wesser in Germany and Wesser in Switzerland, but I don't really actively participate there. A little bit, yeah, but in safe hand with Peter Renz and his teams. But later on, I can give you also some insight of what has been going on there. But mainly, I'm Managing Director of Wesser UK and Wesser Spain.
Fantastic, thank you very much. Okay, so we'll dive straight into the questions. The first one we've got is from Paula Radley at Greenpeace, and I think it's the one for Jade Moore, because it's definitely a HR question. What are you doing regards sick pay if a fundraiser gets sick with COVID? And is your policy for someone with COVID positive any different than any other illness?
Great question. It's not, no. All of our employees are entitled to contractual sick pay based on a length of service criteria. So the only difference that we would have, say, for example, if someone has COVID symptoms or is self-isolating, is that for COVID-related absences, you are entitled to day 1 sickness with SSP, but all other periods of absence will be covered by contractual sick pay. And we are a very supportive organisation, and naturally, regardless of the reasons why an employee may be off sick, we will support them as much as possible, and that will include regular opportunities to catch up with the individual, keeping up to date with any changes or developments with their health, and ensuring that we've had the time required to implement reasonable adjustments if required, or any other support factors that might be needed.
Fantastic, thank you very much. The next one comes from Luke Dyer at UNICEF and Luke Dyer Consulting. So this is one for you, James. What scale is your relaunch currently at?
Well, currently we're active with just one of our charity partners in the UK, but next week we actually restart with our Scottish charity partner, and by the end of September we will have completed the full relaunch with all of our charity partners that we're currently active with.
Fantastic, fantastic. And then the next one, I should just say another one from Luke at UNICEF is what do the results look like post relaunch versus pre-lockdown? And that's one's for you, Joey.
So pre-lockdown, we had an efficiency of 11.1 supporters a week. And then post-lockdown, we've seen an increase to an efficiency of 13.2 supporters a week. Now, obviously, our 2-week test team was made up of our very best fundraisers who were highly motivated and rested, of course, so we did expect to see a rise. And there was naturally a bit of a dip in the efficiency the week after the test, and when we brought back nearly all the fundraisers. But since then, the efficiency has gone back up again. So now, of course, the aim is to keep up that consistent performance.
Fantastic, fantastic. Okay, and the next one then from another one from Paula at Greenpeace. In fact, Kelvin Hopkins at the Professional Fundraiser asked pretty much exactly the same question. So we mentioned on the last collaboration event we attended with Greenpeace that we'd had an increase in results. Is this due to the high number of people in home, working from home? Is it more conversations or better conversion rates because of the charity and the charity's cause? And yeah, that's one for you, James.
Yeah, thank you. All three is the simple answer. The more honest answer is it goes along the lines of what Joey was just saying there. At that collaboration event, we just had our restart team restart. We're seeing all three of those factors in play. And we did see a higher efficiency straight away. Then obviously, as we brought more people back in, the efficiency did drop back down, and it went from that touching on 20 to back down to what we were expecting and what we were getting pre-COVID. So currently we are seeing the same results now.
Brilliant. So that's good that things have returned pretty much to as they were before we were in lockdown then, essentially, yeah?
Pretty much.
Oh, fantastic, fantastic. On the subject of results, actually, I suppose now's a good time to hand over to you, Martin, to kind of give us an insight into how things have changed in Germany, Switzerland and Spain, if possible.
Yeah, thank you, Ollie. The reality is that in those countries, there have been very different realities in respect to the pandemic. Particularly in Germany and in Switzerland, the pandemic has been a lot less severe compared to, for example, the UK and Spain. And so there has been also like different time frames getting back on your feet. Yeah. So Germany and Switzerland, they started the operations again in the first week of May with both good results. Germany does 80% of the activity door to door, and that has resumed strongly. The first weeks were very strong, a lot better than before. And right now it's a tick better than before, yeah, due to the reasons which also James mentioned. Yeah, we also have private sites, and we're struggling more to get those again up on the feet, but little by little, there are more activity coming along again. In respect to Switzerland, they also started first week of May again. It's 100% door-to-door activity, very strong, stronger than before. And it's also in respect to the PPP, to the personal protection equipment usage. It's also different. Yeah, for example, in Germany, we have our face shields, or you can wear a mask. Yeah, whereas, for example, in Switzerland, it's not necessary. So it's different altogether. But in Switzerland, we have seen a very strong influx of new people, new recruits. So inclusively, we have more people working than the year before. But it's also a very strong team in Switzerland. And if we go to Spain, we started on the 15th of June, a country really hardly hit by the pandemic. It's still very, very hardly hit, comparable perhaps to the UK with local lockdowns. Not really lockdowns, but you have sort of like reduced activity in different areas. But before we were working 70% on private sites. This has now been reduced 5% on private sites. We've been working 20% on the streets, and now we're actually working 85% on our activities on the streets. And we've been working 10% on the doors, and that's still the same. The doors, the efficiency is a little bit better than before. And obviously the private sites, it's really hard at the moment to get some permits and permission on private sites. There are a few, but very little. But our main activity with almost 500 fundraisers is now on the streets with 85%. It was tough, but it's getting better week after week after week. And we're seeing some solid numbers, although it's not as good as it was before. But we do hope that by September, we're going to have more private sites back. but it's definitely a bigger challenge, I would say, particularly if you have been highly dependent on private sites. It's a harder job because it's simply you just don't get the permissions, as simple as that. Yeah, but I'm positive this will come, and the team is doing a great effort, on the streets, and we can be happy.
Fantastic. It sounds positive. Sounds very positive. It's interesting you mentioned the local lockdowns there, to sort of segues into the next question rather nicely. Another interesting one from Luke. I think, Matt, if you want to take this one, but what are your plans should there be a second lockdown, either regionally or nationwide?
I was really pleased to have got this question because it's a really, really tough one. So thanks for that, Ollie. But I guess it really depends on the circumstances. There have already been local lockdowns and regional lockdowns in the UK. But currently we still have the use of the furlough scheme, so it isn't causing massive issues. So in those situations where we've had staff that would otherwise be fundraising in areas under local lockdowns, we've refurloughed them. Okay. I'm still unconvinced that a second national lockdown is actually on the cards. The localised regional approach seems a little bit more likely to me, from reading the political tea leaves, I suppose, and stuff that's in the news. But as with a lot of stuff over the last 6 months, we have to respond depending on the circumstances. Whether that's a local or regional or national lockdown, whether we have the help of some kind of government support, so a furlough scheme or something that takes the place of the furlough scheme moving forward, and whether the lockdown applies to group settings or is across the board, whether it's pretty retail, barbers, etc., all the things that kind of came in last. So I don't know if that really answers the question, but it's the best we can do. We have to respond to the circumstances.
No, I think that's fair. There's a lot of theory involved in that at the minute, I guess, but it is all we have, unfortunately, in a lot of cases. But no, I think that's absolutely fine. Absolutely fine. Okay, and the next one then for Joey, from Sam Butler at Starlight Children's Foundation. How are fundraisers or teams dealing with those who are fearful of COVID-19 or shielding when knocking on doors? And has there been any increase in complaints because of that kind of thing?
Yeah, thanks for the question, Sam. That's a really important question as well, of course, in terms of our preparation for the relaunch and the restart. So our relaunch training days included COVID-19 awareness training, code of conduct training, and a treating people fairly module that obviously includes how to respond appropriately to the different needs of individuals. So we have a clear company policy that if you encounter anybody who is shielding, you must exit the conversation in a polite manner as soon as possible. Okay. To hopefully ease any anxiety the public may have about someone coming to their door, we implemented social distancing of 2 meters, use of PPE, including face masks. We disinfect the tablet before and after each use. We don't exchange any materials anymore, including supporter leaflets. So all the information that was previously given out at the end of the donation in terms of materials, that's all available online now. We also use a 2 meter long, very strong selfie stick for the sign up process. It carries the tablet, and that's just to ensure that social distancing can be maintained. And also as well, we members of the public must opt in to any interaction. So yeah, we only speak to people that have initially said, yes, I'm happy to continue with the conversation. So our fundraisers as well, they complete a daily feedback form through Microsoft Forms. And every other day, someone feeds back about a concern that may have been raised by a member of the public whilst they're fundraising regarding face-to-face fundraising during a pandemic. So what we did, we created a COVID-19 FAQs handling concerns document to help answer questions such as why are you fundraising, or what safety measures have you got in place to protect fundraisers and also the public. Another one such as like, why aren't you wearing gloves? So everyone basically felt comfortable in case questions or concerns did pop up. So far, we haven't yielded a COVID specific complaint, and we hope this continues, of course, and that's part of our zero complaints culture that we're trying to create.
Oh, fantastic. Thank you very much, Joey. Interesting, it ties in very well with another question that came up a couple of days ago, which was, did representing health or medical charities change the way that Wesser approached the relaunch? And was there any additional considerations that needed to be made? Now, I think you've covered a lot of that there, to be fair, Joey. As you can tell, we took a very strict approach to our relaunch and invested a huge amount of time in making sure that even if IOF, government, fundraising regulator guidance permitted us to go out into the field, we were still entirely confident it would meet the needs of the public and ultimately feed into that zero complaints culture, or that zero complaints approach that we talked about there. Interestingly, our view of it was there would be a higher expectation of things like PPE. There's no point having PPE if it isn't used appropriately. So hence why it now features in our code of conduct addendum, and we've got a full usage policy in place to make sure that fundraisers can't make a mistake, if you like, with regards to how they utilise the PPE provided to them. I think it's also one of those things where naturally reputational risk plays a huge part in relaunching post-COVID. I know there's a lot of organisations that were concerned about how they were going to get back into the field or how they would be perceived by the public. And I think based on what we've seen so far, and hopefully some of the answers to the questions today have sort of shown that the public have been very welcoming, very, very positive about the way that we've engaged with them. Naturally, certain things have to be done to make sure everything's done by the book, but ultimately, a lot of people are very happy about having a conversation. If anything, by having medical charities working frontline with the public, supporting the public, saving the public, even just providing a level of care to the public in such a way that they could be engaged with during COVID. Appreciate it was a very difficult time for a lot of people. Those organisations have got a real positive story to tell now. And I think although we shouldn't be signing people up just because of COVID-19 to particular causes, we should expect that the public in some ways will be very positive about what work has been done. And that's for St Giles and a number of others. And I think we've seen that so far already with individuals saying, wow, it's incredible. The additional media coverage naturally helps, but we're more than happy to engage these people and educate them about what else the charity does, aside from just dealing with COVID-19 issues. Okay, the next one that came up was last week. You resumed recruitment of new fundraisers. How has the selection and training process changed post-lockdown? I suppose that's one for you, Matt.
Yeah, thank you, Ollie. So before the official lockdown, we paused recruitment activities, and with the exception of myself, all recruitment staff were furloughed. So myself and other managers used that time to start reimagining what recruitment and selection would look like under the new normal, with a kind of vague idea of how that might look. So while we've always used video calling platforms, things like Skype for interviewing pre-lockdown alongside face-to-face interviews, we still were heavily reliant on face-to-face group settings, especially for our final selection and training. The big challenge was to rework this into something that we could do online without the need for anyone to travel excessively or any large groups of people to be physically in a room together, each of which obviously brings its own risks now. So initially we thought it was just a case of changing the medium, moving from a physical room to a virtual one, in this case a Zoom room. But we pretty quickly realised after a couple of run-throughs it's not quite that simple. There are things you can do in physical rooms that you can't do in a Zoom call, and vice versa. Things definitely need to be shorter, snappier and more interactive. Everyone, especially these days, has experienced Zoom fatigue. Staring at a screen for a long time really does you in eventually. It is a real phenomenon. So we had to rework all of our interviews and training to not only be virtual and utilise the virtual rooms, but also utilise the additional features that those things allow. Things like interactive quizzes and polls, screen sharing, live annotation, those kind of things. So in that sense, it's not just a case of moving from one format to the other, but using the format to shape the content. And that's probably the biggest takeaway from this, one of the things that we had to change. But as well as that, we also have tightened up our selection. So we brought the rest of the recruitment team back last week, and we've now got stricter criteria for our interviews and selection processes. This is part of just the fact we aren't able to handle as many candidates in final selection and training as we may used to be in the past. Zoom calls are just not built for more than say 5 or 6 people. So our capacity to kind of finally assess people is probably reduced by about 30–40%, which means that we're naturally being more selective. But we've also introduced things just to kind of lower the risk, things like DBS checking for all new staff fundraisers. It's probably, our selection process in general is probably more demanding and tougher than it ever has been. But given the circumstances and the potential risks of taking on the wrong people, we think that makes perfect sense.
Okay. No, thanks very much, Matt. Okay, and the final question, which I think is one that I think all of us can answer, because I think we've all had kind of different views of what things have looked like post relaunch. It's the final one from Luke at UNICEF, actually. what has been your most useful learning post relaunch? And I'll hand over to James first, if that's okay.
Thanks, Ollie. For me, it was that we can always adapt and that we can always evolve. People from inside the industry and friends and family as well, you know, they throughout lockdown they were asking me, what do you think it's going to be like when you finally get back out there? And my message or my comment to them was always one of positivity, one of hope, and always pretty much the same, that I thought it was going to be amazing, you know. And I thought that it was going to be amazing because fundraisers have two real jobs to do, and that is to inspire and that is to build rapport with somebody on the doorstep or at a site. We're very, very lucky, firstly, with the charities that we work with. They are incredible charities that have done tremendous work. So it's not that hard to inspire people when talking about the work that they've been doing throughout the pandemic. Then when you look at the second point about rapport, which is building a connection between two people where trust and respect is built effortlessly and you can have a conversation with them. Well, the pandemic has brought us closer to our friends. It's brought us closer to our families and to what matters most. But as a nation, COVID-19 plus lockdown plus an inspiring fundraiser equals basically the ultimate recipe for rapport. So yeah, those two things have really worked in our favour, and I think that that's what I've really taken away from all of this.
Oh, brilliant! Fantastic. And Joey, if you want to take the lead on the next bit.
Yeah, okay, yeah, well, that's quite a good answer, James, about the the adaptation evolving. So I'll go with a bit more of a technical one then. So I guess obviously all industries have moved processes online. So from a technical view, like discovering best practices for those new digital platforms that we now use. They've definitely been useful learnings. Like Matt said, I'm sure we've all suffered from Zoom fatigue at some point during the lockdown. So what we've done, basically, we've worked hard to find different ways to keep people's attention throughout the training, including quizzes, polls, breakout rooms, games you can easily do online, things like that. Yeah, so that's definitely been beneficial. But in terms of moving to these digital platforms, I'd say as a company, we've definitely taken full advantage of the benefits of technology as well. So our charity partners can now train our fundraisers far more frequently than they've ever been able to do before. And so the fundraisers have that genuinely cutting edge charity updates whenever they need it, really, and it helps to build that strong relationship between the charity partners and our fundraisers as well. We can also identify positive and negative trends from the online feedback forms that we ask fundraisers to fill out. So we're able to address any trends, negative or positive, faster than we've ever done before there as well. So.
Oh, brilliant. No, it's probably one of the things that's top of my list, I think, is kind of innovation and adapting to the environment, and certainly meeting the needs of the public and making sure they're getting the very best service despite the challenging environment is such an important thing. So yeah, the use of technology is a great thing, and I think it's showing already. There's a lot of organisations are stepping up their investment in tech to get them out in the field and make their lives fundraising at least a little bit easier. So that's great. No, great answer. Okay, next one, and then to Jade.
Thank you, Ollie. I would say, well, as HR manager, my main priority, my biggest objective is to ensure the welfare and safety of employees at all times. So the most important part of my day starts with now having to ensure that we're as up to date as we need to be, to ensure that we've covered any new changes in legislation. And it hasn't always been easy. There's a huge amount of time required to be invested in making sure that we have the right information and then exploring further when there hasn't been the clarity. In addition to that, we have a lot of questions from staff that we haven't always been able to answer. So as much as we're in a new normal now, we're all having to learn to adapt to new ways. I've never come across a situation where I'm not able to call for, say, further expert advice and be told we just don't know the answer. So I've really found that quite a challenge, but at the same time, I've enjoyed learning different ways to support staff and to really make sure that time is there to implement these new processes. So it's been a challenge because there's lots to do all of the time. Things change very, very quickly, often without clarity. As I'm sure we all know, the government have changed things as and when required. But ultimately, whilst that's been a challenge, on the upside there, I've got to work with some people that I haven't really got the opportunity to speak to previously before. So I've turned that into a huge positive, and I've enjoyed it, but it has been challenging.
Fantastic. Thanks very much. Okay, and then to Matt.
Yeah, just to follow up on what Jay said, I think less so speaking to people I don't normally speak to, but I don't think I've ever had so much interaction with my fellow managers as I had during lockdown, because one, we were some of the only staff working, but also it was so easy to get us together in a Teams or Zoom room. I don't think I ever saw as much of you people as I did then. So that was great. But I think the main thing for me was just I think the level of innovation. So obviously, like, necessity breeds invention. There were so many things that we learned how to do, or we realized that we could change so much quicker than we ever have done in the past, just because the necessity was there. Like, we have always been kind of, I mean, as a fundraising company, we were always kind of focused on this face-to-face side of things, and we always kind of like held face-to-face interactions really, really high. So being able to change entirely to a company that, you know, for recruitment and selection anyway, we do all of our processes in a virtual setting or online, and then that we could do that without too many issues was like, it was so impressive for me. And I think it's in so many different areas. I mean, moving over from, we used to use Skype as a platform for interviews, and then realizing that obviously having done so many Zoom calls that we could use Zoom for so much more as well, and it's so much easier to access. So there's so much there, but it's mainly just you know, when times are tough, like, innovation is necessary and almost easier to do. So that's the main one for me.
Fantastic, fantastic. And then Martin.
During all my years as a professional, I mean, I've done quite a lot of SWOT analysis, and never in any SWOT analysis in all those years has any team member put down as a threat pandemic. And as a massive learning curve, I think it will probably in the future, it will be on all SWOT analysis, you know, going forward. And so when the whole thing started, basically the door was shut. But then on the other hand, there's always, like, in a SWOT analysis, an opportunity. So for me, the learning curve is, I knew this before, but like also during this pandemic, you know, if you have a good team, everything will be fine. And it's particularly when the team is driven by opening this door again and say, okay, and realizing, I think, as a learning point, as a relatively early state, I think all of us, which were presented here, I think we all knew this is not going to go away. So we need to create an environment in which people can safely work, but at the same time, you know, going a little bit further and beyond, and also creating the people being aware that we have to fight this pandemic together as a whole, not only as a company, but also like in your personal activities, the opportunity to get it right is there. I think we get it right, or we got it right, and I think even more important, I think the biggest challenge is probably yet to come, because a lot of the people which went into furlough now came back to us with work with us. And now we have new people joining, and this is something which before, as Matt said, you know, we did this by face-to-face interviews. Now we're doing it via video conferences, which is probably the second biggest learning curve for myself. I would have never imagined, that it's possible, to be so effective, via Zoom calls, team calls, all the other platforms, by far. We had so many of those. So to some extent, it's always then going forward. You're going to think, you know, when are we going to do again our face-to-face meetings? I myself haven't been back to the UK for different reasons, but you know, the company is still running, So as I said, you know, if you have a great team, everything will be fine. So but thank you, Ollie. Very great idea, this session. Thank you.
All right, thank you very much. Thank you very much. And it's interesting, the Zoom and Teams thing, I think is going to come up a lot over the next few months. As I said earlier, it's the you're on mute thing seems to be the term of the century at the minute. So let's see how we progress. But yeah, that's the last of the questions. But just a quick thank you to everyone who submitted the questions for today. We're hoping that if there is an appetite for this sort of thing in the future, we'd like to do them more often. I think they're a great way to kind of share information within the sector. And like I said earlier on, help agencies and charities find a way forward in somewhat challenging times. If you do have any questions that come up after today, feel free to put a comment in the LinkedIn comments on the Wesser corporate page, or even try and visit us on our Facebook page if you prefer. But you can also email us at inquiries@wesser.co.uk. So do let us know if there's any further questions, and we hope to see you all again soon. But thank you very much again, and thank you very much, guys, for taking part today. It's been brilliant, and thank you very much for your insight. Much appreciated.
Thank you, Ollie.
Thank you.
Cheers,
Bye-bye.
guys.
Cheers.